A new study is looking to determine the impacts of long COVID on smell. Well, for more on this, we're joined live by Dr. Lee Sowerby, Associate Professor in Department of Head and Neck Surgery at Western University. Thanks so much for joining us, Doctor. Obviously, this is not only concerning for a lot of people, but for other people out there who've been dealing with other long COVID issues. To talk to us a little bit about how this is, what your research is finding here, and how this is going to impact people on the long term.
Sure. Thanks so much for having us. The issue with COVID that was quite interesting is we saw a loss of smell in about half of the patients who had COVID. Over about 2 months, 95% or so of those patients would have a return of their sense of smell back to, by and large, what was their baseline. A small minority were left with a permanent loss of smell, or anosmia with that, or hyposmia, which is a decreased sense of smell. Now, within that, there's even smaller group that were left with parosmia. Now, parosmia is a distortion in the sense of smell. You can imagine if every time you took a bite of meat or you were eating something with garlic or with onion in it, that it just smelled like rotten food, how challenging that would be. Much along the same lines as if, all of a sudden the smell that you associated with your partner was changed to the point where you really couldn't stand the sense of smell that that person was putting off. It becomes quite challenging to live your life. The motivation for our study was really to try and capture what had been tried to treat this problem, because our current treatment for it really wasn't doing a great job.
Well, I was going to ask you, how can someone treat this, and is there, developments underway to try and, I guess, correct this issue? Because this is probably causing major inconvenience for a lot of people out there.
It is. There's a very small minority, but you can imagine that it is quite significantly debilitating to some of these patients. What we were hearing from them was frustration, and that they were not really retrieving adequate therapies to help with addressing the issue. And so the idea with our survey was to capture some of the options that had been tried. Some of those were on patients' own prerogatives, and some of them were considered experimental. And so, what's come out of that is that our usual go-to of using nasal steroids or smell retraining for this patient population wasn't making a huge difference. But interestingly and somewhat confusingly, a block of a nerve in the neck was helping with perhaps the largest minority of patients with having improvement in the parosmias they're experiencing.
That's very interesting stuff, and I know a lot of people out there who did experience the loss of a smell for a bit, and I'm sure they're probably interested in finding a lot more about this. Dr. Lee Sowerby, we appreciate your time. Thank you so much.
Thanks for having us. Appreciate it.